Will Pennsylvania expand Medicaid eligibility? I'm Jill Horner. This is Comcast Newsmakers. With me is Pennsylvania State Representative DiGirolamo. Thanks so much for being with us.
Good to be with you, Jill.
Let's talk a little bit about Medicaid as it currently stands in the Commonwealth. There are about 2 million people enrolled in the current program. What would expanding the program mean for many people who are currently without insurance?
Yeah. As part of the Affordable Health Care Act, the states have the option right now of whether to take this Medicaid expansion from the federal government. And I think what it will mean for Pennsylvania, and all the studies coming back are pretty similar, say the same thing, that it potentially could insure between 700,000 and 800,000 people here in Pennsylvania with the new Medicaid expansion that do not have health insurance. And I think the important part of this to remember is, Jill, that they're raising the income limits up on this Medicaid expansion. So most of these people that will be covered are people who are currently in the workforce, currently working, but maybe only making minimum wage or $10, $12, $14 an hour. So they have jobs, they're working, but they have no medical coverage at their place of employment. These are the people that this Medicaid expansion will cover. And these are the 700,000 to 800,000 people in Pennsylvania that will get medical coverage if we agree to accept this Medicaid expansion.
And that's where we stand right now, whether the Commonwealth will agree to opt into this. Other states have already made decisions, but the Commonwealth has not yet.
Presently, Governor Corbett, to his credit, and I agree with him, he'd like to have some questions answered about how this is going to benefit and how this is going to fit Pennsylvania, and also, I think importantly, how we're going to pay for it. The way the program works, starting in 2014, the federal government for the first 3 years, 14, 15, and 16, will pick up 100% of the cost.
Of the expansion.
Of the expansion, and that's estimated to be between $3.5 and $4 billion a year coming into Pennsylvania to cover these people.
And that's different in terms of the ratio of where it stands now for current Medicaid coverage.
The current Medicaid program, which as you said is very expensive, and there's almost 2 million people in Pennsylvania, is there. Right now, the way the present program works is that the federal government picks up 54% of the cost, but the state has to pick up 46% of the cost. So a big difference between the present program and the expansion. Now with the expansion, the state, after the first 3 years, does have to put a portion of the money in. I think in 2018 it's a 95-5 split where the state pays 5%, and it goes up a little bit to the year 2020 where it becomes permanently a 90-10 split where the federal government pays 90% and the state pays 10%. Still an awful lot of money, and that's what the governor's trying to figure out, because even at 10%, you're looking at $300 to $400 million the cost of the state. So that's what the governor's, right now, I think he's trying to figure out what's the best fit for Pennsylvania and how we're going to pay for it.
And we just have a short time left, but what kind of impact could this have on hospitals and on doctors?
All the studies point to a tremendous impact. First, you're getting people health care coverage. Second, these people are going to show up at the hospitals anyway, and the hospitals are going to be forced to treat them, and they're not going to get paid for their treatment. That's going to be uncompensated care. So it's important to the hospitals to get this. And the last study that I looked at said that if this infusion of federal money comes into Pennsylvania, that we're going to probably create between 35,000 and 40,000 new jobs here in Pennsylvania.
Thanks so much for being with us.
Good to be with you, Jill.
We've been talking with Pennsylvania State Representative DiGirolamo. I'm Jill Horner.